Dr. Jainer, if I may, storage at minus 70 degrees, would this be difficult even in the UK to transport it and to administer it to a large population? And how does that happen? Does it happen through the NHS, ma'am, and at hospitals, or will special centers need to be set up?
Yes, and I think that is the key, Gaurav, that we, because it has to be stored at a certain temperature, so the NHS staff will be prioritized. Sorry, it's gone a bit dark here, but the NHS staff will be prioritized because it's easier to give in hospitals. It's easier to give in residential homes, where it's harder in smaller primary care centers. I don't know if the viewers understand what NHS is, but basically it's a national health service in UK, where 95% of the health services are provided by the government. So it is, the government buys them in bulk, and then it is going to be transported on dry ice to the big hospitals. And the NHS staff who are working there, the people who are frontline,
Yes.
doctors, nurses, they will be prioritized. The elderly people in residential homes, because majority of the elderly population in the West don't actually stay within homes, which we have the advantage in India, or disadvantage, whichever way you look
Yes.
at it. I think for the vaccine, it is, so the residential homes are the ones where we had massive mortality in the summer and spring. And we want to ensure that these people are not hospitalized and do not die in hospital. So we'll try and tackle them first. Not tackle them, protect them first.
Will
basically.
cost be an issue? Before I come back to Dr. Mahajan, you know, with some saying that this could be as expensive as maybe $100 a dose or more, and does it have to be two shots, ma'am? Is that what is that what we understand? That's point one. And point two, 10 years compressed to 10 months. Dr. Mahajan says shouldn't be a reason to be concerned, but people on the streets in the UK are saying they'd rather wait and watch. Could there be side effects?
I think that is the apprehension a lot of people have. But however, I would like to assure the MHRA, which is the Medicine and Health Regulatory Body Authority for us in UK, they have ensured that it's a safe. They have actually they are okay with it, and they are actually now going to approve the Oxford AstraZeneca one as well. So they are very clear, and they would not take any shortcuts. Yes, the work has been compressed, but quite often a lot of the work was already done prior to that, but it had to be specifically made for the COVID vaccine. And that is how, so the scientists have been working really hard, and
Yes.
so have the molecular biologists. And I think the cost is an issue. The cost, they're saying it's about $39 per dose, and then you have to give 2. Oxford AstraZeneca one will be much cheaper. It's about £3, which is about 250 rupees in India. So I would, most of the, like the majority of the UK will get that vaccine later, because it has the advantage of storage in the fridge. So you can store it in the fridge. And a lot of the primary health centers.
In fact,
sorry.
Absolutely, that would be the game changer, the cost and the storage.